Hi everyone, I'm Alifa Rizwan. Today we are having a chat with Mr. Madura Hewage, a trainer and a certified addiction professional, to know more about people having drug problems and how they think, how they see their drug use. Madura, we warmly welcome you to the show. First of all, I would like to know why we need to understand drug users' mentality. Do they think differently or do they have the same mindset?
Thank you, Alifa. Yes. Have you met people abusing drugs? Or have you met people taking treatments for their drug addiction? Have you met people in recovery? So, if you have you ever observed the way they respond to their drug problem? If you take 10 drug users, they have 10 different opinions about their drug use. Why is that? So, to understand that, we need to dig into their thinking. We need to understand their level of motivation, level of readiness to go for a treatment. What do they think about their drug use, treatment, recovery? That's why we need to understand their mentality, their level of readiness.
How to identify the way they think? Is there any technique, any accepted ways to identify their level of readiness?
Yes, there's a model that helps us to understand their level of readiness to change. This is called the Transtheoretical model, developed by Prochaska and Diclemente. This is kind of a cycle that shows someone's level of motivation related to something. This is not developed only for SUD, substance use disorder, but it can be applied to many areas to understand what should be done at different levels. But when it comes to SUD, we can have an idea where the client is, to what extent he or she is motivated to take action. In this cycle, we have five main levels, namely pre contemplation, contemplation, preparation, action, and maintenance.
How can we use it in a practical sense? What is pre contemplation?
Pre contemplation. At this stage, you do not accept you have a drug problem, but you are using drugs and you define yourself as a social drinker, recreational drug user, etc. At this level, you do not see any harm or accept that this will become a big issue in the future, and you think no need stop it. Simply, you are not ready to stop drugs. But that doesn't mean that nothing has happened to your biological body, yet you haven't seen it or you have ignored it, saying that it's due to something else.
Okay, that means he needs treatments. Can't we suggest him the treatment options?
Aha, yes, you can. But there's no point. He is not ready to accept because it's not a problem to him. He doesn't see this as a problem. You see? So if you ask him to stop smoking and save that money, he'll say it's his money and that he hasn't neglected his responsibilities either. He'll say that his family is in good health and that he has given all the facilities to them. He has a place to live, a luxury vehicle, and he'll ask you what your problem is. So if you try to show him that he could have built another house, if he saved the money he spent on smoking, he'll definitely ask where the second house you built without smoking cigarette. So you can understand their mentality. There's no point talking about treatment options or going to treatment centers. You are just wasting time.
What can we do? Do we have to wait till they face a big issue, or how do we tackle them?
Ah, yes. If you want, you can wait, but we can have a strategic move at this stage. At this stage, our aim should be to move him from pre contemplation stage to contemplation stage rather than talking about treatment options.
So, what can we do?
So, since they are using drugs, they might be interested in reading or watching content related to drugs. They might be interested in knowing the effects of drugs. So, you can share information with them. If you are on a field visit, you can give them a leaflet. So, these days, you can use social media as well. You can WhatsApp a video link, and that will slowly move them to the next level, which we call the contemplation stage.
I see. It's kind of a step-by-step method. Is there a sequential order? I mean, do you have to move the user from a pre-contemplation stage to a contemplation stage and so on?
Yes, you can, but following a sequence is not a must. Here we are talking about their level of readiness, their level of motivation. After reading the leaflet or watching the video, they may directly go to a doctor or to a counselor. They will take action, and sometimes they will give up treatment and might go back to the pre-contemplation stage, thinking the way they lived is better than this and there's no harm. So the cycle is to have an understanding where they are and how they think and what we can do at each stage, rather than telling the same thing to everyone in different stages. This is why you need to be very careful in conducting general awareness sessions for drug prevention, because you might be having participants who are using drugs representing different stages. So you have to be very careful with what you say. Otherwise, your drug prevention campaign will turn into a drug promotion campaign. One wrong word will ruin the entire session.
Now I feel like that we are in the middle of surgery. You have to select the correct set of tools and handle it accordingly. Okay, now we know about pre-contemplation, and from there onwards we are going to the next stage, contemplation. What is it? What is contemplation stage?
Yes, contemplation stage. Now you are aware. You accept that your drug use will lead to a big issue in the future, but you are not sure whether you should go for treatment or not. You are on the fence. So you start to contemplate, analyze, examine the pros and cons. You are hesitant to take a action because you don't want to leave your comfort zone the way you are, but you see a problem. Sometimes you are afraid of losing your friends you had drugs with. So here you have to have a strategic move. Here you can use a technique called decision balancing. At this stage, you are aware about the advantages and disadvantages of using drugs in an unorganized manner. So to centralize all these ideas and to take a proper decision, you can use this technique. It's very simple, and all you need to do is to have a paper and a pen and list down all the so-called benefits of having drugs in one column and list down all the disadvantages in another column. Same way, you can look at the advantages and disadvantages of reducing or terminating the drug use. So with this exercise, you can centralize your thoughts and take a decision. Obviously, you will see a lot of disadvantages of using drugs. You already knew all these, but it's just that you hadn't organized them in a way to take a decision. With that, you are motivated to move to the next level, preparation stage, where you seek help to take action.
Okay, so now if the decision is taken, why do they need to prepare? They can go for treatment.
Yes, they can, but where to go? What to select? How it works? There are a lot of treatment options out there. They have to know. They need to find the best treatment option that suits them. That's why we need to prepare. In a way, it helps them to save money and time and to improve the effectiveness and expedite their recovery. Because at this stage, they select the most suitable treatment option, considering their availability, accessibility, affordability, and so on.
Right. So in that way, it seems that preparation is very important.
Yes, of course. It's very, very important.
So, can you further explain what exactly is preparation? What are the aspects you need to consider?
Yes, preparation stage. Now you moved from contemplation stage to preparation stage. So you accept you have a problem, you accept you need solution, and you have taken a decision to go for treatment. So at this stage, compared to pre-contemplation or contemplation stages, your level of motivation to accept treatment is very high. So you seek help. You need information about treatment providers, treatment facilities, treatment duration, treatment methods, OPD or residential, whether the privacy and confidentiality is maintained, the cost, the quality of treatment, all these you need to know. Here you can consult a professional to have your plan or to customize your requirement to find the best treatment that suits you, considering your social status, financial status, availability, the severity of the issue, etc. For example, if you are a mother with a small kid, you can't go for a residential treatment. Then the OPD will be the best option for you. So once the best option is selected, the next stage is action.
So, now the most important stage, action. There is no point if you are not taking any action. You can analyze, you can take decisions, you can prepare, but implementation is the most important part. Otherwise, all other efforts are useless. So let's talk about action stage.
Yes, action stage. Now you are in treatment. You are attending meetings, go to counseling sessions, psychotherapy, medication. Normally, a residential treatment program will go from 3 months to 6 months, but it depends. During the action stage, receiving an integrated treatment is very productive and effective. Integrated treatment is a combination of medication, counseling, psychotherapy, etc. So, this kind of a treatment addresses your withdrawal symptoms, gives you an emotional support with counseling, and with CBT, cognitive behavior therapy, helps you to change your thinking to shape your behavior, and MI, motivational techniques, enhances your motivation to stick with the treatment. You will be referred to skill development programs, and you will be empowered with relapse prevention techniques. Knowing relapse prevention techniques is very, very important because the next level is maintenance. You go back to the society where you meet people and face situations that may motivate you to go back to your old habit.
So I see. Go back to the society is a bit challenging, and at the same time, I have heard that drug addiction is a disease that you have to manage, like most of the people manage diabetes. So let's call it maintain your health. So how can we maintain, and what are the challenges?
Yes, the next stage is maintenance. In Western world, addiction is defined as a chronic relapsing brain disease. In other words, they have not mentioned about a total cure. What you can do is maintain recovery, like diabetes. It's bit discouraging, but I have met people who have completely stopped drugs after treatment. Are they in maintenance or totally recovered is a question. Anyway, when you are with the society, you may have to face situations and you will meet people who motivate you to take drugs. Sometimes I have met people who want to test whether they are fully recovered or not. To test that, they take drugs. Sometimes recovery is a big achievement for some people. Yes, it is. And they tend to celebrate it with drugs. So there are a lot of things out there that motivates you to go back to your old habit. So if you took drugs once at this stage, we call it lapse. So you must always try to be in contact with a support network that motivates you to maintain recovery. And you must remember that lapse is not the end of the world. It's common in recovery. With proper discipline, self motivation, and with the support of your support network, you can go back to your maintenance. You can maintain your recovery. But if you continue to take drugs, if you act carelessly, you might relapse. In other words, you will go back to your drug use. This is why the practical use of relapse prevention techniques and proper follow up systems are very, very important at this stage.
Okay, so follow up systems, follow up mechanisms are very important. I also 100% agree with that. I think that is the most lacking part in many fields. Now we have come to the end of our show, and I would like you to recap all the stages and to highlight if there's anything special that we need to understand when working with people with drug problems.
Yeah. So we start with pre-contemplation, where you did not accept that you have a problem, and with some information, then we move to a contemplation stage, where you accept that you have a problem, but is in doubt whether you need to go for treatment or not. After balancing pros and cons, you decided to go for treatment. Then you move to preparation stage, where you had to. Then you move to preparation stage, where you had to select the best suitable option, treatment option. Then you move to action stage of receiving treatment, medication, CBT, MI, psychotherapy, and all. Yeah. You received an integrated treatment and empowered with relapse prevention techniques and sent back to the society to maintain your recovery. The maintenance stage. Poor maintenance led to lapse and then relapse. Proper maintenance and aftercare replaces your old habit with a healthy lifestyle. So, this is a cycle that shows the level of motivation to embrace treatment, recovery at different stages. And there's no rule that one must move from one level to the next immediate level in this cycle in a sequential manner. The person in action stage might go back to pre contemplation stage, or a client coming to a treatment center with his or her family member may not be in action stage. He or she can still be in pre contemplation stage, but has come to the center because of the family member insisted. So you have to be very careful in dealing with individuals in different levels. levels because their motivation and readiness vary based on the level they are. So you have to have a good understanding about where your client is, and you should carefully select the information, facilities, and techniques that suits him or her corresponding to the level he or she is in.
Okay, right information at the right time, making right selection at the right time, receiving an integrated treatment is the key to a successful recovery. And maintaining the recovery is a bit challenging, but with proper relapse prevention technique is possible.
Yes, exactly. Recovery is possible. Right decision at the right time will lead to recovery.
Right decision at the right time. So think about yourself, think about your friends, think about your society, where they are. So thank you, Madura, for coming today. So hope our listeners have been able to gain more knowledge on drug abuse management with today's chat with Madura session. So once again, I would like to thank Madura for sharing his knowledge with us. We'll be meeting you next time with another chat with Madura session, and we'll discuss more on relapse prevention, which plays a major role in maintaining your recovery. So please subscribe to the channel, and you will be informed with our next video. Thank you and have a nice day.
Thank you, Alifa, and thank you all. Have a nice day.